I don't even know. I've never streamed live to YouTube. All right. So webinar is now streaming live. Awesome. Okay, we're going to see what happens. All right, we did it. Webinar is now streaming live. Awesome. Yay. Okay, so we are live on YouTube. All right, we did it. All right, so do you have reverb in the background? Can you hear that at the same time?
I do.
Okay. All right, so now I got to figure out how to pause that. Now what do I do? Okay, anyway, we're just going to get to it, and I'm just going to introduce you. So welcome everybody to Wellness Wednesdays. This is Dr. Noah Erickson, and I am so excited to introduce him. My name is Tracy Stroup, and I'm excited that everyone's here joining us tonight. This is our first YouTube live stream, so this is awesome. And Dr. Noah, you are a doctor of chiropractic medicine, a licensed acupuncturist. You also have a degree in sports medicine, biology, and you specialize in children, true, adults, everybody. So this is great. And tonight you have some information, tips, and advice for all of our loyal patrons on getting back to school, what to do with our children. So I'm just really excited to have you here. Thank you for joining us.
Well, yes, Tracy, thank you as well. And I thought, it'd be a really neat topic to talk about is children in COVID, because they'll inevitably be playing sports and eventually getting back to school. You have your friends over your house. And I also thought if we could, as we learn more and more about COVID and how it works and how can we strengthen our bodies, if we could tie in some of the greater principles of natural medicine, getting well, staying well, lowering inflammation, looking at our underlying load of bugs like viruses, maybe we could kind of use this model of how COVID's working and tie it into how we've been treating kids for years. And we chatted a little bit ago about the prevalence of asthma and autism and a lot of kids with gastrointestinal problems. So I hope tonight that we can kind of use the COVID-19 as an example of how these viruses cause inflammation. I think that'll eventually be the underlying theme. And I'd like to take on some pretty big points about immunity and inflammation, and even some concerns as we move forward as some different drugs or vaccinations become available. I know a lot of parents are reaching out to me with a lot of concerns because I've worked with kids now for the past 16 plus years. And I've got a base of people that are coming to me with some concerns about a lot of things. And I so appreciate you again having me on so we can shed some light on that topic.
Yeah, it's fabulous. And I know parents are concerned. And, what do we do when we come back together in the fall? And, you were saying about sports and things of that nature. So can you just give us a little background on the virus? What does this look like? Just give us some pathology maybe.
Yeah, sure thing. So I initially set out to be a biology teacher. I went to a couple schools here in Pennsylvania and ended up with a few different degrees. And I actually ended up getting sick myself. So I had some issues with my own health, gastrointestinal problems, fatigue, anxiety, and a whole host of problems. So I'd like to come at this from a personal level, but also maybe somewhat of a teaching level. So I thought we could all kind of just relax a little bit and have some fun. So in mind of that, I brought two little pieces here with me, okay? This little guy is the virus. So that crazy thing called coronavirus 19 is just saying that in the year 2019, they have investigated another strain of corona. There's a total of 6 known, and we can look back to 2002 and talk about SARS. And then we can jump forward to 2012 and talk about the MERS, which is the Middle Eastern Respiratory Syndrome, which was another viral situation, and now up to date. So if we're out in public now at a gas station, a grocery store, the post office, we're all wearing these, right, guys? I have an N95 here, and we're wearing gloves a whole lot of times. So we're trying to do our best to put up our barriers. But let's just say that pesky little virus sneaks in our respiratory tract or in our eyes, and we breathe it in, or we bring our hands to our face and we end up getting that virus in. What that little critter does is it comes down through our body, and it's got some neat little antennas on there, And the one we're interested in is called an S-spike protein. It's an antenna that comes inside of our air tubes, and they're called the trachea. And eventually they go into our air.
Well, I think you froze, Dr. Noah, so we're going to have to see if we can get you back here real quick. So let's see if we can get Dr. Noah back. We are streaming live on YouTube right now in case you're watching from Facebook. And Dr. Noah will be right back. There he is. So good to have you back.
Hey there.
All right, back to you.
Technology.
Well, you know, it's been really glitchy today all over the place. So I think this message must be really important because somebody doesn't want you to get it out. So I think that just puts more validity on it.
Our system's
Continue.
glitching, but we will prevail.
That's right. We'll just keep jumping back on here.
Where was I, Tracy, when we left off there?
You said these little guys and then you froze. So back up a little bit. Yep, start at that.
These little guys, that says a virus particle, and they have parts, antennas. And in particular, there's a little antenna on here called an S-spike protein that comes down our windpipes and goes into our air sacs. So I brought some good old bubble wrap. Could you imagine if that thing came in and it decided to attack a receptor that a lot of people know about if they're taking a blood pressure medicine? That little receptor, almost like a key fitting into a lock. So this now fitting into this, and it perfectly comes in and sets in. That little critter is called an ACE2 receptor. So it's in our lungs on the cell that secretes this fluid that prevents these air sacs from collapsing. All right, so now the plot thickens. The virus came in, it locked onto me, but an explosion starts to happen. Those explosive chemicals have goofy names. Categorically, we call it a cytokine response, and it's a good response. So we do need inflammation. Think if you get a bump or a bruise, inflammation sounds off to the immune system, says, hey guys, help, I need a healing over here. Interleukin-1 beta, TNF alpha, interleukin-6, they come out and start to cause ruckus. Inflammation ensues. What happens then? We're now learning, guys, with corona, it's not all about the air sac. Therefore, it's not all about ventilation to blow up the air sacs, right? It's also what happens when the bloodstream gets involved. So another little cell comes along, and I'll use this guy. This little cell comes along, and that's called a neutrophil. And he's trying to check out because this novel coronavirus, your immune system's never seen before. So it's saying, help, I need major backup. Neutrophils, come to the area, give me some support. So now that fighter cell called a macrophage, who's spilling out all that excitement and inflammation, got its buddy coming in. But now what happens, guys, if I draw a blood vessel, let's pretend my red pen's a blood vessel, that blood vessel starts to leak. Fluid can come into my lungs, and that's kind of a bacterial viral pneumonia presentation, okay? So fluids and debris and mucus and gunk is filling up my air sacs. That's not good because remember, guys, these exchange oxygen and carbon dioxide to keep us alive, okay? But in the bloodstream, we're learning now, there's a cell inside there called a red blood cell, and it starts to push off something that carries the precious oxygen called hemoglobin. And now that we kick that guy off, my brain doesn't get oxygen. My organs don't get oxygen. So what do you think we have a problem building? We have now a body problem. This is the important point about so many chronic diseases. We have a virus, in this case, right? SARS-CoV-2, causing something called ARDS, acute respiratory distress syndrome. Oh my word, I can't breathe, I'm in trouble. It's going systemic. And Tracy and I know this is one of the foundational principles of functional medicine, natural medicine, integrative medicine, and hopefully soon to be worldwide accepted as this global pandemic is bringing to our attention how a virus attaching to one spot can tick off the rest of the body. Now, if this goes further, you'll see liver enzymes going high. you'll see kidney levels like a BUN and creatinine going high. And
Mhm.
peculiar to this disease, you actually see a low white count and a low lymphocyte count. Normally, you'd expect if your body's trying to fight a virus, those go up. And I have a lot to say about that and minerals and vitamins, but I'll stop right there. Again, it comes in, it attaches, an explosion occurs, and it's not just local to the lungs, guys. Remember signs: loss of smell, loss of taste, later on diarrhea, headaches, lethargy, fever. Why? Because those chemicals cross the precious blood-brain barrier. They go into a center that regulates temperature, and now we have fever, right? Shortness of breath, cough, fever, those three symptoms we keep hearing. But as we learn more, it goes systemic, and that's where I'll let you take over, Tracy, and you can help to enlighten that concept too.
Yeah, so that's amazing because they said that this actual infection is acting like what they consider altitude sickness, which is a deoxygenation, which is why the ventilators really aren't working. And with what you just explained, that just puts so much light on the subject for me.
And, maybe to protect ourselves too, we could say it's April the 22nd, and you and I are humbly wide open to learning more. But as
Right.
we are all kind of feverishly studying this and we're learning on the fly, we're thinking, how do we apply basic principles of the immune system, both the
Mhm.
innate and the acquired, which again, because it's novel, we go, we've never seen you before, help. And there's massive inflammation. But we're also saying, what can we learn about this to help ourselves? And that's what you and I want to bring, a message of health, help, and hope tonight, to say, wait a minute, we know there's medicines out there that are working, but the question is always why. And I think
Right.
that cool term is called biohacking, right? The nerdy term is called pathophysiology. In other words, how does something actually work? But if we biohack together tonight, we're going to say we realize that Plaquenil, an old anti-malarial drug, which is a parasite, you might think of that as hydroxychloroquine, that's working in some regards. We know that Zithromax is working. That's an antibiotic. Now, I did astutely and intentionally say viral and bacterial ammonia because we now know Prevotella and other types of bad dudes can hang out. My message to the world is misery loves company. And you and I are going to talk about this.
Right.
If I'm a bad dude and I want to hang out with other good dudes, they probably won't stay too long. But if I love misery, it loves company. So a virus plus a lingering bacteria is now going to explode. And there's some viruses out there called bacteriophages that love to infect bacteria and cause more inflammation and more systemic response. And again,
Wow.
that's where the plot thickens for the entire thing of autoimmune diseases. How many people have autoimmune
Mhm.
diseases? Hashimoto's thyroiditis, rheumatoid arthritis, multiple sclerosis, just to name a few. If we really dig deep, could we start to biohack these pathways of inflammation by using vitamins and minerals, much in the same way that we're using antivirals,
Mhm.
antibacterials, antiparasiticals, and IV fluids? So there's a whole concept that now I think globally our message to the world is, can we all just come together on this? We don't know exactly at this point in time every nitty gritty detail of COVID-19 and how it works. But as we learn, I think if we take principles of the body, disease, and apply it in both lights, the classic traditional allopathic medicine and this more functional, natural, holistic medicine, we can hopefully all agree.
Yeah, amen. Absolutely.
Oh,
And, I love that you are breaking down the science for us, putting it in layman's terms a bit, but also staying clinical. I think hitting both of those pathways is incredible and very much appreciated by our audience because I know it's a mixture. It's a mixture of parents who want to know and clinicians who want to help parents who want to know. So this is
yeah,
a really good learning opportunity tonight.
you bet. So why don't we dive into the clinical? I mentioned
Mhm.
before a few blood labs, right? You're familiar with going and getting a CBC, or you get
Mhm.
a cholesterol panel or vitamin D level, maybe, right? And that more and more doctors are doing that, thankfully, and that's great. But what about these markers I said? And that's what I'm saying. Think of it this way, guys. Those groups that are high risk, respiratory patients, to include our kiddos talking about tonight, many asthmatics, heart
Mhm.
disease patients, and diabetics. And there are some kids who are pre-diabetic too. It's relevant. The concept here, though, is your baseline level of inflammation determines the crescendo of the immune response. So we want to say, wait a minute, could we in our kids, and also adults, don't turn the station yet, could we actually find out if there's markers of inflammation? In our world, we talk about this a lot. I'm not talking about a SED rate. I'm not talking about an anti-nuclear antibody. I'm not talking about a CRP, although they're very valid. And we use those for rheumatoid and different markers, even for Lyme patients and mold patients. But this kind of new alphabet soup and this kind of lingo is a little bit different. So we look at markers for food allergies, right? Because food can inflame your gut. It's a hollow space and it can allow breaching of chemicals and impurities to go through your entire body. Remember that the vehicle, again, and the station docking point for COVID-19 is the lungs, right? I said before, it's the lungs. It locks and docks in here. But what if something started in your intestine? What if something started in your sinuses, like a fungal infection or a bacterial infection, and it just kind of caused a systemic bodily problem? What about other conditions we look at is vitamin and mineral imbalances? We're hearing lots about zinc and how it shuts down viral replication. We're hearing a whole lot about vitamin D because guess what, guys? It builds your immune system. More specifically, it increases macrophages to help clean up the cellular debris with a little Pac-Man thing called a lysosome. So anyhow, it cleans it up. We're hearing about people getting vitamin C therapy. Why? It boosts those blood counts that goes low and it helps your immunity. So here's the deal. Underlying food allergies, underlying chronic infections, underlying vitamin and mineral deficiencies. And here's a shocker. There's a lot of parents out there, and I hope this becomes more well-known, concerned about Lyme disease. I know we're so hyper-focused on viruses right now. I get it. But guys, Lyme disease is going crazy. My kids play baseball. A few years back, we were at the park. One of the kids sitting next to us, just watching the game, went home later that night, had a tick. A few weeks later, after the body responded, had a positive result and ended up with Lyme disease, crippling disease of the legs. So we're saying we see these infections out there, and there's something else in addition to Lyme disease that's out there a whole lot. And it's mold. We say about over half of the buildings have water infiltration. They have damage. They release chemicals in schools. Here's the thing, Tracy, you talked about schools before.
Yeah.
So appreciate that. We now know it's going to be a huge problem when they lay down those floors in schools. Think kids trips in boots that are snowy. It's raining outside. Water goes somewhere. As the kids leave for the weekend and over the summer, the HVAC unit, recirculating air with moisture in it, shuts down. All mold needs is a growth medium called cellulose. So it needs some dust and some moisture, and it grows. Your kid breathes that in. Teachers breathe that in. Everybody's complaining, I'm getting watery eyes, I'm stuffy, my throat feels mucousy, I have asthma, I have shortness of breath. This is how we're saying you come preloaded and Corona pulls the trigger. So in order to have your kid go play outdoor sports or indoor sports or have some buddies over the house or go back to school, we are focusing right now on a message of health. What can you do to identify these factors? And the markers are a little bit different. It's the alphabet soup again. We're talking about something that looks at inflammation in a little different light, but we're talking about the gut, the foods, the vitamins, the minerals, and I could say a whole lot more relevant to Corona and the lungs. One thing in common, in the lung parenchyma of everybody with SARS, they're finding low glutathione. So that's saying in my lung tissue, I see something that should protect my lungs and sweep out the debris. And that's how we're pulling some of our patients out of ARDS. And Tracy, you and I have been talking about this. And I so appreciate your presentation too. And you getting out them are N-acetylcysteine. It's like a Pac-Man kind of a thing. NAC, if you will, instead of Pac-Man, NAC-Man. NAC-Man comes along. They use it for cystic fibrosis, chew up the mucus. It makes a vacuum cleaner called glutathione that protects my lung tissue, and I start to breathe again. This entire flip-flop is when we have too much allergies and inflammation and not enough immune system. So waging the war against corona moving forward, it cannot be, hear me on this, it cannot be all about just controlling the infection. It has to be controlling inflammation. So my global message, my heart cries out tonight, if you could just hear me, we have to identify factors of inflammation, right? Asthma, respiratory disorders, cardiovascular disease, and insulin. And if you want the chemistry behind the diabetics, it's the insulin connection. And deep inside the cell, it's a switch called SIR2. It's a SIRT2 receptor. And once it gets flicked on, inflammation goes bonkers. But we now know if we increase the protector switch and turn it on, called NRF2, we can use things like turmeric and quercetin and broccoli seed extract to activate that to help you wage the battle against inflammation. We also know the favorite sleepy time remedy of both children and adults, melatonin, it activates a switch in there called NLRP3. It sounds like I'm talking Star Wars language. You know,
this is great. I've never had such an alphabet lesson. This is great.
It's crazy, right? But it turns on that switch and we'll name it, okay, so what, NLRP3, and that's how melatonin's controlling. So can you see the blessings of this? Sometimes we use melatonin, sometimes we use vitamin C, sometimes we use zinc, for example, to stop viral replication, kind of in the same fashion that Plaquenil is working, but we can all come together to agree on this. And there's some wonderful science coming out right now that's showing how both alternative integrative medicine can actually coexist with traditional, allopathic style medicine.
Absolutely. And they found the combination when they were talking about the, the medication plus the zinc. It was the combination that really worked effectively. And initially people made fun of it. And then all of a sudden they were like, wait a second, there's something to this. So basically we're looking at underlying inflammation. And the best advice right now is for parents to understand how to help their children become less inflamed, right? So that when we do go back to school and there could be a virus still, we're less susceptible. And the best nutrient for this particular virus is actually the one you need. Is that pretty much fair to say, right?
Yeah, very cool. So hopefully we can get our kids out and get some vitamin D. But parents, let's go 3 tips, okay?
Yeah.
Number 1, diet. I did a video clip about this probably about 3 weeks ago, and I really haven't changed at all on it. But I always say this, we're going to avoid sugar to lower inflammation. So we'll say try not to. Candies, cookies, cakes, donuts, pies, ice cream, and soda. Okay, or pop.
You just named the sad diet, right?
Yeah.
The standard American diet.
Right, but now I'm thinking, once you look at other areas, maybe that's the truth because they say we're winning it with these cases, and oh my word, but a global message. So if we can lower sugar, the secret is we lower inflammation.
Yep.
An easy thing too, guys. So many people, we're talking about before this happened, probiotics, right? I want good gut health. It was kind of trendy to get your stool checked and talk about Prevotella, streptococcal. I treat a lot of kids who have major health problems that begin in the gut. Asthma, allergies, inflammation, autism. We call it the gut-brain connection, right? So we can look at gut health. Probiotics are great right now. Prebiotics are great. What does that mean? If your kiddos like fermented vegetables, perhaps you like drinking something called kombucha, maybe you did fermented foods, and your prebiotics, guys, raw onions and garlic and asparagus, those kind of things, you can make awesome stews and soups. In fact, my wife started something where she's putting out this, hey mom, what's for dinner thing? And we're now trying to all share ideas. So keep those coming, guys. We need them too. We're getting desperate. I have to admit, I wanted to be a school teacher, but I don't know that we all want to do this via, video. So anyhow, what's another thing we can do besides we talked about lowering sugar, helping the gut? I think the third thing is here, why don't we start a few simple vitamins and where you get those in food? Vitamin C, oranges, tangerines, right? You adults out there, lemon water is a simple way of doing it. What about vitamin A? We know that vitamin A actually protects something in our lungs. And it also helps to bolster something called the side of the immune system called Th1. So things like carrots, right? Kids love to munch on carrots. They're easy. Apricots. Why not do some dried trail mixes and apricots? That's easy and fun. If your kids ever snack on colored bell peppers, that's fun. Maybe instead of potato, you have a yam. So these are all sources of vitamin A. What's something else you're hearing? What about zinc? If you guys are into meat, great, you can get it from some meats. But if you're not, you can always get it from legumes, nuts, and seeds. So maybe trail mix is kind of fun. And I know we're all sort of in the kitchen looking for ideas and recipes right now. So maybe you guys can get your kids involved. But think about that. There's really cool ways to kind of get these vitamins and minerals. And then Tracy too, we know supplements too this time to get to therapeutic levels. I've always said to people before, you want a TD, a touchdown? Well, not necessarily in nutrition. You want a therapeutic dose of TD. You want a TD to win the game against Corona, to win the game against asthma, to win the game against autoimmunological diseases. And you need to hit a therapeutic dose. So I know a lot of people are scared. Wait a minute, I heard zinc interferes with mineral metabolism. Wait a minute, I heard that vitamin C causes Stop a minute, guys. I have 16 years of doing this. I have a living laboratory. I worked at one of the largest integrative medicine centers in this United States, giving IV vitamin C at 25 to 50,000, I'll say that again, 50,000 milligrams intravenously. I've been giving out zinc to kids, but I have tons of experience and thousands of case charts where I know ideal dosages where you generally don't hit that. So for example, let's be practical. Zinc for a child, I'm very comfortable between 15 and 30 milligrams. Zinc for an adult, I'm very comfortable between 50 to 100. Now for both of those cases, both kiddos and adults, that would go up if you were infected. So keep in mind, we are here for you. We're still opening. We're offering telemedicine. If you want to do one of those consults, I'm here to help you, but hopefully continue to learn tonight about some of these major issues and questions you guys are asking about.
So that I'm so glad you brought that up. I think we've become nutrient phobic, right? We just are so afraid of taking any type of nutrition at a therapeutic level. And I think it's a wonderful thing that you have clinical experience to back this up and say, you've worked with this, you know it's effective, and it's okay. Also, if you just take a minute and let people know where to find you, because I think you're going to have several parents that are going to be calling you up for some consultation advice.
Sure thing. Thanks. We have a website. It's called innovativefamilywellness.com. That's innovativefamilywellness.com. And a lot of you guys know me. If you just type in Dr. Noah's Ark, that's Autism Recovery Center. A lot of you guys know me from that. And I always like to have fun. So thanks for saying that, Tracy. And yep, I'm here to help you guys in any way I can. So reach out if we can be of some help to you.
Yeah.
But when it comes to kids, I'm going to get you out in the playground for the next example. Okay.
Good.
Think of you being on a seesaw. A lot of you kids come to me with your allergies up. Okay. You have foods, molds, Lyme. So you're kind of like this inflamed bucket. And on the seesaw, think of it going this way, this way, this way, this way. Okay. What you're doing over here, this side of the immune system fights infection, bacteria, virus, parasite. Now, who's that? Let's make it relevant. Could that be SARS-CoV-2? Okay, it might. But for kids, HSV1, HSV2, that's a cold sore. A lot of my kids get viruses on warts on their hands and feet. What else can that be? Bugs. So guys, you come to me, you're immunosuppressed. You don't have a good army to fight, and you have a lot of allergies in adults. You tip the scale for me. You tip it by becoming stressed. So don't run around with your hair on fire about COVID-19. Be calm, right? You know those shirts, you got calm, right? Stay calm. But here's the deal. Stress chemicals called cortisol and norepinephrine drive this up. Allergies to food and environment drive this up. When you drive me up, you suppress me over here. So you take more precious energy that should be directed at killing this virus and these residual bacteria. And what happens is this is the process of autoimmune disease. When I can't regulate, I can't shut off another cell guy, another police officer called Th17. So we say you're Th2 dominant, and that triggers suppression of your fighter guy, Th1, that shoves this whole cascade of inflammation. And guess who pours out? Back to a Herx reaction for all of you patients out there. A Herx reaction is a cytokine storm, massive inflammation. Remember, these guys again meeting up. Who are you? I don't recognize you. I don't want your help. And then boom, it goes off. And when it goes off chronically, that's the difference between systemic inflammatory syndrome right now with COVID and chronic inflammatory response syndrome. All I'm saying is for a long time, you have low-grade viruses, Epstein-Barr, mono, right? You have low-grade in kids, cytomegalomy, hand, foot, and mouth disease. You've got residual viruses that maybe aren't as explosive as corona, but it's adding to your bucket. So we have to do total body decolonization. We've got to whack down the good guys, stop your allergies and inflammation. Adults, stop stressing, meditation, prayer, good sleep hygiene, pull that down. That's how we take you out of the crisis. And it's also how we deal with autoimmune disease, rheumatoid arthritis again, multiple sclerosis, thyroid patients, Crohn's patients, bowel patients. If you delicately look at these parameters, you'll see maybe through all of this pandemic and tragedy, and our prayers go out to those families afflicted, our thanks and immense gratitude and love goes out to those healthcare workers on the front lines and everyone keeping the country going. We love you and thank you. But if there's a global message that can come of this, we don't want to sit back and live in fear. We don't want to be vulnerable. We want to apply science to this. We want to be astute about this, and we want to make good, scientifically based clinical decisions and understand that we can be empowered. And there's a series of nutrients and there's a variety of drugs that can help somebody with this condition. But the far-reaching message, because this too shall pass, this too shall pass. The far-reaching message is that in due time, we can explain the roots of autoimmunological disease, which you and I, Tracy, have been talking about for a long time. It's just now brought to the public's attention because it's the first time the world is watching and saying, oh my word, what do I do? How do I, number one, not get it? And if I get it, how do I survive it? And that's pretty morbid. So basically, we're here to say we have natural remedies to help you. Hopefully, if you get it, beat this thing down. And it's the first time, in my opinion, that natural medicine can serve in an emergency fashion. How do I say that? If you're in a respirator, a ventilator, excuse me, and you're given IV vitamin C, you can have it hope. If you get glutathione and N-acetylcysteine, these things to sweep out the debris, to bolster your immune counts, while you're undergoing therapy and you're getting IV fluids, there's something that you can do here to overcome. So I don't know, in my own years of suffering, some almost 25 years ago now, with all my problems, I don't know that I've ever seen on the front line of critical care, a place for natural medicine, which is actually, when you think about it, where we started eons ago before the tides changes. And now we kind of have this diametrically opposed and semi-dogmatic attitude about naturals versus this, but that's where we're sharing the information and tying it back to testing.
Yeah, no, this is amazing. You're on fire. And, I love it. I love your passion. And I love the fact that you're really looking at the root. You can't come in on your seesaw, as you said, top heavy with allergies and inflammation, and then expect our immune system to work properly in time of crisis. It just doesn't work that way.
To say,
I know.
sorry.
Go ahead. No, I was going to.
Please go ahead.
No, go ahead. because I'm going to go to a different topic
Okay,
next.
just to say it nicely, you want your baseline level of inflammation low, which is what we're good at doing. And you want the crescendo or the pace of inflammation to be controlled. And that's what we could talk all day long about melatonin and glutathione and herbs and vitamins. And if I may say one quick thing, the herbs can be antiviral, like astragalus. The herbs can be helping with the inflammation, like curcumin. And the herbs can be adaptogenic, helping with your stress. So things like ashwagandha. So I'll just throw that out there. But herbs have a big place, as do essential oils and nebulizers. These are simple things that you can do and buy and infuse your oils and your silver into your respiratory passages. And you can take with you out when you're in public instead of hand washing, as President Trump said, I'm sorry, every 15 minutes and feeling like you can't get around anybody, you can't shake somebody's hand anymore, which I totally get it. But there's a sense that I think fear is overwhelming and it's very respectful, but we feel like we can't even touch or breathe. Why not carry silver with you and spray silver in your nasal passages? Why not spray silver in your throat? So when you're out, you can decrease other viruses. I can't tell you if CoV2 is specific to being killed by colloidal silver, but I can tell you I've used it for years on children, yes, children and adults, and it's other ways that you can do to knock down this whole inflammatory process and keep yourself at a lower level where the bucket is not as full of bugs and germs.
Right. And someone had just messaged me the other day. They're like, can you find hand sanitizer? And I said, no, but I'm not looking for it. I use colloidal silver gel or I have the spray. And yeah, I mean, it is the perfect storm of things right now. It is our extremely unhealthy population. And we were talking about this before, and you say it, I say it. There's never been a time in history where people are more focused on their health and more aware that they're unhealthy, that their pharmaceuticals can't save them, that the hygiene, all that they're doing, still, it doesn't give them the layer of protection of confidence. And it's really about understanding your body and everything you're sharing with us tonight, that it does matter. Diet does matter. Sleep does matter. All those foundational things that we've been talking about for 2 years, with Nutritional Frontiers, they matter. So one of the questions that comes up, and I'm going to ask the tough question. Are you ready? What about a vaccination? Can you give us your insight on why not, what your thoughts are, maybe just how it works in general so we can make our own conclusion on that?
Yeah, sure. Okay. So I mentioned before I treat adults and kids. If there's one polarizing issue that seems to separate natural, holistic, functional communities, both parents and some practitioners, and traditional allopathic, it's the issue on vaccines. I think the cry out and the call out for years has been, we all want immunized. We want protection, right? Because so many people are saying, hey, this COVID's been around since December, January, and now they're just finding out, right? In California, it has been. So we're going, hey, great. There's a lot of people that have these antibodies that have already made fighter cells against this, and great. We like that concept. But I think there's 3 main points here to talk about. And I want to do this just with grace and addressing the parents' concern. Because in this field, I do have parents who've come forth and expressed concern. Even parents from traditional medical backgrounds. They said, I heard, or my neighbor said, or I read a blog, or someone on the internet. So it should be brought out with delicacy and facts. And I think there's 3 main points, Tracy.
Okay.
Number 1 point, inflammation. Could something foreign to your body cause inflammation? I think that's a concern. Number 2, could something in your body cause overstimulation? That's a concern. Why does my child have these behaviors now? And that seemingly, according to some, have been connected to a post-vaccination or inoculation reaction. Number 3, was there something in there, either allergenic or as a chemical preservative, that may have caused a problem? So let's just stop a second. Let's define those. Number one, if we talk about something of inflammation, we're going to tie it back to COVID to try to keep it relevant. Cytokines, interleukin-1 beta, TNF alpha, and interleukin-6. These markers we often look at with kids on the spectrum and kids who have immunological challenges and kids who have gut problems because their inflammation is high. So if something foreign to the body, a denatured pathogen, a live attenuated pathogen might trigger something, could we move forward? Whether we agree or disagree which camp you want to put yourself in and say, wait a minute, science rules. I used to watch Going On a Science Guy, I love him. Science rules. Okay, could we maybe say there's things that actually block a cytokine storm? I just talked about them. We're excited about glutathione. We're excited about alpha lipoic acid. We're excited about vitamin C and the NRF2 activators, curcumin, broccoli seed extract. Science, stop, science. Broccoli seed extract has shown to help children on the spectrum. Shown. Gluten casein-free diets have. So if we theorize, parents, there's an inflammatory response to something foreign to the body, causing inflammation. It breaches the gut barrier. Remember I said in the lungs, we're saying it's the lung barrier. Science, the gap tight junctions in the intestine, and there's markers, zonulin, calprotectin, eosinophil protein X. You can see if you have a leaky gut. So it's not all about just running and taking probiotics. You can heal your gut. When you heal your gut, you heal your brain. The brain wears a helmet beside your skull, okay? It's called the blood-brain barrier. It's the helmet your brain wears. If you have a leaky gut, think of being in your shower and in the mortar in the shower and kind of like the grit between your tiles, right? That grout is as a hole and water might get in there. If your gut does the same thing, chemicals can come in there. Impurities my bloodstream doesn't recognize, almost like ARDS, local to the lungs, becoming SIRS, now bodily. Do you catch me? Lungs to body, gut to body. Now you can breach my precious blood-brain barrier. Cells, microglial and astrocytes. They're like the police and firemen. They're always kind of on immune surveillance, looking to see what's up. If you have inflammation here, it can be here. That opens up, just like the mechanism of ARDS and this new thing we're finding in the bloodstream, inflammation comes. That opens up. Science, mast cell activation syndrome. There's cells that blow up histamine, an inflammatory chemical. That comes out. Your blood-brain barrier opens up. Toxins and impurities in your blood come in. Name them, please. I hate when people say toxins and they back out because they don't know what they're talking about. Acetaldehyde from yeast, from my kids with oxalic acid disorders, from my kids who don't have enough good bacteria. You can get lipopolysaccharide. You can have ammonia, a known neurotoxin that should be out through your kidneys and in the urine, but it doesn't. So there's a milieu of chemicals that can infiltrate your brain. That's one thought. Can we combat that? We can. Okay, number two, and be clear when I talk, I'm not saying I'm for or against them. I want to talk to you. Maybe you do decide to get a vaccine. What could you consider doing? Number two, if you're stimulated too much, who is this? It has a name, monosodium glutamate. They're glutamates. We know that in neuroscience. We say that Alzheimer's is autism of the aged population. Why? Glutamate hyperexcites brain neurons, blows them up, influxes something we all like to talk about, calcium, and without magnesium and without zinc, you can't block a receptor in the brain called NMDA, non-methyl D-aspartate. If you don't, now you have brain on fire. You get stims, hand flapping, toe walking, echolalia. These are issues. There's another seesaw ratio I talk about. It is the Gaba to the glutamate ratio. If you have high glutamate, you cannot sleep. You can have angst and panic. And what happens at the receptor level, you hijack an enzyme called IDO that makes serotonin, and you deplete serotonin, and now you have depression and insomnia and angst and panic because you don't make melatonin and you're not methylating, you're not changing these chemistries one to this guy. That's the problem. Now, the third big factor I said before is something called, let's say, categorically speaking, you know, an allergen or impurity. They have names. They're called adjuvants. Tie this in a second back to Corona. I say M&Ms, metals and microbes, they love one another. Do you know that bacteria suck up aluminum? Do you know that viruses suck up mercury? I'm not pointing fingers. Please hear my heart. This is biology. That's factual. If a parent is concerned about something as an allergen, do we have antidotes? Yes. Quercetin, vitamin C, they stop that load. If you're concerned about maybe a preservative or something in there, like it used to be mercury when I first started in all this, it was all about mercury, right? How many kids are eating fish? It could come from the mother with mercury amalgams. It could come from the parent. It could come from environmental exposure. And when it gets in the brain, it's now called ionic mercury, which is difficult to remove. That's science. So it can be environmental, nothing against the inoculation. But if there's something there called aluminum, could we not grab it and pull it out? And that scary term is called chelation. But stop a second. Your body has something called metallothionein protein. It's activated to pull out gunk by what? Zinc. You also have something in your body called glutathione. It is we talked about this before, a vacuum cleaner to clean up the cells. So kids take ALA and acetylcysteine, vitamin C, vitamin E to pull this out. So if you're afraid as a parent of inoculations, you can think to yourself, wait a minute, my body has inherent mechanisms. Why does that kid get one and that kid gets one and that kid across the street gets one and they all have a different outcome? Maybe a whole group of kids get them and they're fine. Or in families, this is so perplexing to families. In families, maybe they have 5 or 6 kids and one child they suspect had a negative response. Why? Dive into the genetics. Look at the genetics. And Tracy, I'm going to wrap it up here a sec. When you're into genetics, it talks to you about detoxification. It talks to you about the anti-aging pathway. It talks to you about maintenance of brain chemicals. So you can say, do I have a predisposing factor, not accusatory of the vaccine? Please hear me. Do I have a predisposing factor that if my immune system, hello again, back to COVID, is tripped up and tripped off and peeved, could I have an exaggerated, inappropriate response to something that would otherwise create an immunity in my body? And the answer is yes. Because if we say right now there's people walking around with IgG and IgM immunoglobulins, great, they're now probably not going to get COVID again. Or if they do, they can at least recognize it and fight it and not cry out and scream out and storm. So if you decide to get them, you can think to yourself, what do I do to address some of these 3 main possibilities? And then I move forward in faith, and I don't have fear. And I know as a parent or a grandparent, you can say, I've done my best with the knowledge I've been given and not have this dogmatic response. So on top of this, I'm thinking this, when it comes to the corona and children, maybe this is the first time that we can have a discussion and recognize that inflammation could be the root cause of many diseases.
I'm at a loss for words. This is a first for me. I really have nothing to contribute, though. That was amazing. Incredible. And I love how you just put it all together for us as parents, gave us hope, There are things we can do now, absolutely, bring inflammation down. Again, so important for parents to pay attention to nutrition, diet, right? Gut health. But yes, if they do choose to vaccinate, right, and they choose that path, that's okay. There are things that they can do if they know their children's predisposition. So it is important to see a practitioner and to help parents understand what are the best choices. And we have that science now. We have the ability to find out. So I always say, why guess when you could know? You know, don't play a guessing game with your health. Go find out what pathway you need. Go to somebody that can help you, like you. And this was amazing. So I
And if
really
I just
enjoyed
may
this.
end
Thank
on
you.
something there too,
Hmm.
I shared with you earlier, I first trained as an EMT. I actually grew up in the South Hills of Pittsburgh and worked for a neat firm there that served several of those smaller communities and suburbs in Pittsburgh. Loved it. Ended up working in an integrative medicine center headed by two medical doctors who are really well known for blending the best of both. And then I took in my biology background. I wanted to be a teacher. So
Hmm.
I've always thought, geez, if somehow we could unite these two seemingly divided branches and actually offer the best of both to children and adults, maybe we could do that. So I guess in closing, we could say here, is this a time, again, with Corona as our example, is this a time possibly where we could look at some of these biohacks or pathophysiology of how a
Hmm.
virus works and how it causes an infection, right? Fever, shortness of breath, I hurt, I'm tired. And what it does now systemically all over my whole body, and apply that to other things that we deal with, and now start taking personal responsibility for our own health. So if I could empower you guys, there's testing. And I think that's the big fault, to be honest and candid. When I first got into this, I'll be very honest, I went to somebody and they were just sort of talking and giving me herbs and remedies and pushing on my arm and my feet. And it didn't make sense to me. I'm sorry. And it's maybe my personal bias, maybe my colored bias. I came into it with science and EMT and life saving and biology. And maybe I wasn't ready for it. I apologize for that. But it didn't make sense. So I ran. I'll be honest. I ran. About a year later, I came back. And when I went to somebody that could show me tests, it resonated with me. And my hope, thought, and prayers, parents and folks out there, okay, people of all nations and countries, if you test this stuff and you look at these levels, I think you'll feel like, hey, I went to a real doctor. Like, they actually asked me, is my zinc ratio in proportion to other vitamins and minerals okay, where I can take zinc and feel good about it? They looked at my vitamin D level and they just try to sell me a bottle of vitamin D. They said, hey, you're level 19 and it should be, way higher. Take some vitamin D. I think if I said, hey, here's the problem with your gut, not this leaky gut, here's my probiotic, but hey, you have these markers of inflammation, you have a body problem, and that's why your joints hurt. That's why you have chronic fatigue. That's why you have rheumatoid. That's why you have lupus. If we put it into testing and then showcase it that way, I think it's a whole lot more palatable. So I'm on your side, guys. I think sit right in the middle where I want the best of both, right? I kind of want the Eastern medicine philosophies, right? I'm an acupuncturist. I love nutrition and stuff. I want that, but yet this side of my brain, if you will, whatever, I want that Western, show me, prove it to me.
Hmm.
Tracy, you and I were talking earlier. I have a lot of, engineers that come in here. I have a lot of nurses and medical health professionals, and they want the
Oh
facts, right?
yeah,
They
yeah.
don't
My
want the,
brother's an
hey,
engineer.
here's my bottle. Okay, 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 you got it. You got it. So they
Hmm.
want the proof. Show me the facts, man. And if you can't, then I understand why you turn your nose and go, that ain't my cup of tea. I'm out of here.
Sure.
Okay. So I understand that. And I hope to think with the future of how this could progress, if we test and talk science, we could all move
Mhm.
forward and implement drugs and surgeries and vaccines and procedures and medications. And with the advent of epigenetics, whoa, feel really good about getting medical procedures in conjunction with natural health techniques.
Yeah, absolutely. I mean, everybody keeps talking about our new normal. And maybe this was something that had to come in and break the system for us to see that we have to emerge with a new way of approaching health, not just disease management and over here, complete allopathic, right? Medication, symptom repression, not over here with we're going to prevent the world from any type of disease. It just doesn't happen. We have to be in the middle because disease is really too much of a toxicity and too little of a nutrient. So we have deficiency and toxicity, and we need to be able to tangibly look at what is the level of deficiency? What is the level of toxicity? How do we get that seesaw to balance, right? And walk into our new normal where East really does meet West. And we actually mean it this time. Like we actually mean it. We say it a lot, like East meets West and integrative care, but we didn't really mean it. So we do have to come together. I loved your take on vaccinations. I love that you explained the adjuvants and all the other things that are in it and how it actually works with the body or against the body. And again, that's going to be dependent on too much of a toxicity, right? A predisposition for a reaction, or too little, right? A deficiency that may not guide the body in the way that it actually needs to be, protected through that vaccination process. So I love it. And I really love your heart and I appreciate you so much. I'm in awe of you tonight. So very good. Excellent. I loved
Thanks
it.
for having me. And again, folks, we're here to help. Reach out if I can be of any help to you, but maybe share this with somebody who might need it, or somebody who I was very candid with you and showed, like myself, had maybe a preconceived notion or my clinical opinions were colored and biased ahead of time. Maybe we can break through some big time barriers and knock down the somewhat dogmatic approach of the feuding that seems to go on and the disagreements that way. So I do appreciate everybody tuning in and thank you so much for having me, Tracy.
Yeah, absolutely. You can come back anytime. We'll
Okay.
talk about something cool next time too.
Yeah.
So maybe we can get into all those epigenetics you're talking about. But thank you, Dr. Noah. And I hope and pray that people reach out to you because you are truly a gifted practitioner and an incredible teacher. So thanks for being here tonight.
Thanks
Thank you
all.
for tuning in to Wellness Wednesday. And we'll see you next week right here.
It was
See
fun.
you guys.
Bye.
Absolutely.